My name is Carlie Arabie Pigott. I go to Lamar University. I'm in the College of Arts and Sciences, the Joanne Dishman School of Nursing, and the Baccalaureate of Science in Nursing program. This is my capstone and 5-year plan presentation for NURS 4580 Practicum Synthesis of Professional Nursing. Like I said, my name is Carlie Arabie Pigott, and I am from Baytown, Texas. I'm a registered nurse at Texas Children's Hospital in Houston, Texas, specializing in pediatric hematology and oncology. While at Texas Children's, I am a member of the Texas Children's Retention Council, which works with new grads and new hired nurses to make sure that they stay on with our team. I am a member of the Skin Care Prevalence Committee, where we take 4 days every quarter of the year, and we check every patient in the hospital for hospital-acquired pressure injuries. I am a member of the Central Line Associated Bloodstream Infection Prevention Team, and I am a mentor in the Graduate Nurse Mentorship Program. My membership in professional organizations include the American Nurses Association, the Society of Pediatric Nurses, and the Association of Pediatric Hematology and Oncology Nurses. I am a current Baccalaureate of Science in Nursing student in the Joanne Dishman School of Nursing at Lamar University in Beaumont, Texas. So, as a capstone to my bachelor's in science of nursing, we have been charged with discussing the outcomes that have been set forth throughout the entire program. And so what you'll find is that these next few slides, you'll see our outcomes, and then you'll see a breakdown of how each class helped us, how that class helped us, and then assignments in the classes that helped us along the way. So for our first outcome, practices safe and effective holistic patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. So the classes that help me with that would be our first class, NURS 4390, Nursing Inquiry and Evidence-Based Practice, and NURS 4550, Leadership Management Healthcare Systems. So these courses close the link between theory and research as a foundation for evidence-based practice and how evidence-based practice improves the quality of nursing. So some assignments that help with that, in the Nursing Inquiry and Evidence-Based Practice class, we had multiple assignments over ethics and paradigms, quantitative research concepts, also qualitative research analysis, and then leadership management and healthcare systems. We had global health PowerPoint presentations, where we picked a topic and really dove into how those helped with evidence-based practice, and effective leadership and qualities papers. The next is to support patient and clients in preventing diseases, maintaining wellness, promoting and restoring health, and advocating for death with dignity. So the classes that helped me with that would be NURS 4390, Nursing Inquiries and Evidence-Based Practice, NURS 4321, Nursing Theories and Online Education, as well as NURS 4620, Compromise Multiple Health States. So these courses allow for nursing students to assess virtual patients through shadow health, as well as build on our own skills and knowledge to promote health and wellness to our actual patients in our practice. So the assignments to help with that through evidence-based practice would be care of patients requiring mechanical ventilation and sedation. We had differentiated essential competencies papers where we had to work as a hypothetical nurse as well as a PCA that didn't necessarily follow the rules or see impending danger within our patients, and evidence-based practice that would help us to avoid a patient fall. And then, of course, end-of-life education through evidence-based practice and nursing theories that just teaches us how to be compassionate when a patient is at the end of their life, and to make sure that as they are dying, that they're dying with the dignity and the respect that they deserve as a human being. The next outcome is evaluates patient-centered care for patients or clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. So, of course, the class that helped with that was NURS 4620, compromised and multiple health states. So this course built on our current knowledge of nursing theories, health assessment, medical surgical care, and holistic care, and applied it to the care of compromised patients in multiple health states. So the assignments that we took care of in this class were care of patients requiring mechanical ventilation and sedation, enteral feedings, and surviving sepsis, which those three can be very scary topics when as a new nurse. Next, synthesizes clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. So the class that helped was that with NURS 4390, Nursing Inquiry and Evidence-Based Practice. So Nursing Inquiry and Evidence-Based Practice, or EBP, allowed for nursing students to learn about the professional nurse's role in practice, differentiate ethical issues, and the process of initiating evidence-based practice and commencing its use in the nursing profession. And so we learned about that through our ethics and paradigm discussions, where we worked in small groups and discussed multiple topics about how to remain ethical when legalities come in, and then quantitative research concepts, as well as qualitative research analysis. Employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patient, clients, and members of the interprofessional and intraprofessional healthcare team. So the class that helped with that was NURS 4316, Comprehensive Holistic Health Teams. So this course allowed for the nursing student to gain knowledge while assessing and promoting health and wellness for a virtual patient. So we, as students, use shadow health to assess multiple patients throughout the course. And the main assignments were, skin, hair, and nail system assessments, head, ears, eye, nose, and throat assessments. And then we had more focused assessments in our small groups, such as a cough assessment and a chest pain assessment, where we could give our ideas and our evidence and then bounce off our other classmates' ideas as well. And then differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interprofessional and intraprofessional healthcare team. So NURS 4321, Nursing Theories and Online Education, NURS 4540, Care of Communities, and NURS 4580, Synthesis in Professional Nursing. So these courses allowed for the nurse to build knowledge on the multi-dimensional professions of nursing. These courses touch on the subject of physical assessment, as well as legalities and regulatory bodies of the nursing administration. So, in care of communities, we took care of the U.S. healthcare system finance, just to discuss how important financial stability is within the nursing realm. Global health discussion, where we took one topic and researched it thoroughly to be able to show it to our classmates and have them learn from what we researched, and as well as I learned from what they researched. It was about 15 to 20 topics. And lastly, to demonstrate professional integrity, effective communication, active inquiry, and service to the community. So this was probably one of my favorite outcomes in the BSN program. So I really took after this in my NURS 450 care of communities. So care of communities allowed for me as a member of my community to reach out to a vulnerable population that needed extra resources for storms, hurricanes, for example, preparedness, and shelter-in-place planning. So assignments that encouraged this included the community-based service learning civic pride and diversity assessment, where I actually volunteered with the Montrose Center and an organization called Assist Hers, which helps out elderly LGBT community members that may not feel comfortable asking for help from certain organizations. The Practicum Project Planning Form and Windshield Survey 2, I actually went out into my community and found a vulnerable population that actually needed help for disaster preparedness as well as shelter-in-place preparedness. And I was able to work with my local officials in Baytown to come up with a plan where we could have different organizations and different other members of the community surround our vulnerable population and help them at the time they need most, when they're scared and they need to evacuate or they need to prepare their home for shelter in place. And so lastly, since we are senior nursing students in the baccalaureate nursing program, we are bound to graduate hopefully in May of 2019. I will be graduating in December of 2018. So my goals, my 5-year plan, is to graduate my Bachelor's of Science in Nursing in December 2018. Next would be to attend Lamar University for my Master's of Nursing in Nursing Education. Professionally wise, I would like to be promoted to charge nurse in my nursing unit. Once I graduate with my master's, I would love to go back to my local community college that helped me so much and begin a clinical preceptorship with them. And then to also come on as a nursing faculty at my local community college. My primary goal, my main goal as a nurse, is to get my PhD in nursing education and to begin teaching at a university or a college in the state of Texas. And then eventually I would like to be a nursing director for a college, university, anywhere in the United States. And so lastly, you'll see my references here. You can find all of these courses on Blackboard, information about the Society of Pediatric Nurses, as well as the Texas Board of Nursing. Thank you for listening to my presentation.